As reopening efforts continue across Missouri, we're talking with local health experts about what you need to know to stay safe. We're joined this morning by MU Healthcare Dr. Christelle Ilboudo, and she's an infectious disease specialist and pediatrician. Thank you so much for being on with us this morning.
Thanks for having me.
Of course. And I also wanted to jump back asking about some parents maybe have been skipping vaccines for their children right now just to avoid coming into contact with COVID-19 maybe in clinics and hospitals. Is that a concern for doctors at this time?
No, we have most pediatric clinics or clinics in general have laid out very good plans to separate out sick children from healthy children. I know a lot of them do well visit in the morning and some sick visit in the afternoon. They do temperatures and symptoms check when you first come in, and so it's very safe to go in. What we don't want is to have a measles outbreak because our kids are not getting the vaccines that they need. So as pediatricians, we are urging parents to please take their young children to the pediatricians or to the regular doctor to get the vaccines that they need.
And for viewers just now joining us this morning, I wanted to ask again how people can stay safe when they're going out to eat, because as you know, we're seeing a lot more restaurants starting to reopen their dining rooms during this time.
So the biggest thing to do is, again, as much as possible, trying that social isolation, staying 6 feet from people that are not in your immediate circle, of people who live with you or people who are close to you. And so the businesses have received guidance from our health department about how to keep that distances between customers. But as a customer, that's the best thing I would look at is how crowded is it in there, and how far apart are the tables that they've set, and then how big or small are the table sizes that they're allowing.
Okay. And what about kids? You know, a lot of kids just want to get outside. They want to get back to their baseball or basketball practices. And we've seen a lot of leagues starting back up here in mid-Missouri. Do you have any advice for parents who are letting their kids going back to practice?
So the advice that I have is to really keep those numbers small. We usually say a group of 10s or smaller, and consistent groups of kids, so that if it happens that one of them gets the infection, it's easier to track people who may have been exposed to those individuals. And for older children, as much as possible, creating that safe distance, that 6 feet distance is crucial. For outdoors activities for children, I do not recommend them wearing a mask. Most children are usually playing around and cannot keep the mask on their face when they're younger, and we definitely do not recommend children under 2 to be put in a mask. And so my kids go out and about. We go bike riding, we go out to the park to walk. So certainly you can still go out and do those activities. You just have to be mindful of who's around you, and keeping that circle small.
Dr. Ilboudo, thank you so much for being on with us this morning. We do appreciate your time. I know it's very busy right now.